I have a question about Parkinson's disease. Patient says they have it and want to know if there's a trial they can be involved with. We are doing investigational research or deployment of adipose stem cells, stromal vascular fraction. And also we're looking at laboratory grown stem cells. So if we send a sample of your cells to the lab, we can grow them over and over again so we can give you back large numbers, 50 to 100 million of your own cells multiple times. So this research is being done so we can collect data. We pretty much know that if you have Parkinson's or some neurodegenerative condition, you need cell repair. There's a lot of cells that are damaged by the time you start shaking from Parkinson. We don't know how many. And we do know from our clinical evaluations that a large number of people actually benefit from stem cell therapy and seem to get better. We're also starting to see that by giving larger numbers of stem cells that have been expanded or cultured in the laboratory, we can even do better yet. We don't know how many stem cells it's going to take to repair these problems, but the stem cell is the fundamental tool for repairing these problems. And the reason is because you have an injury, and the injury tells the cell or helps dictate the cell what it needs to become. And the stem cells tend to go to the area of the injury and then help repair it by turning it into the new specialized cell. So we are open to seeing Parkinson's patients. We're not doing a double-blind study yet, as we're still gathering enough clinical data on safety and effectiveness or efficacy to help us then establish parameters that might be necessary for doing real clinical studies with double-blind trials or double-blind evaluations. That's where one group of patients gets a placebo, another group of patients gets a treatment, a real treatment, and then we compare the two so we can show scientifically that there is a difference. Right now we're seeing clinical differences and we're seeing improvements in people that we're actually treating. So we feel like it's a little bit too early to just start doing double-blind studies. Once we've seen enough improvements with treatments, we might actually design studies where we compare different kinds of treatments so we can actually optimize the treatment and not just try to prove whether it works or not. We're pretty sure that most of our treatments actually work because most of our patients have so many other treatments without getting better that it's absolutely illogical to think we have a better placebo with stem cell therapy than we would have without it. And so the real key going forward will be how to optimize treatment, not just whether it works or not.